the most underestimated risk factor for chronic illness. If you've heard of adverse childhood experiences, ACEs, and have a low score, such as 1 or 0 ACEs, you may still suspect that trauma has somehow affected your health, but feel like your doctors and the research are missing something important. Or you may have a high ACE score and feel that it was the emotional abuse or neglect that was the hardest. In other words, you recognize that your childhood was difficult. You got yelled at a lot or had to be a pleaser to keep things running smoothly in your family, or you learned that being quiet and invisible, yes, was the best way to get by. This post introduces huge and unrecognized impact of one of the ACEs known as emotional neglect. I refer to these as adverse childhood relationship experiences, ACEs. Adverse childhood relationship experiences draw from the science that recognizes how these kinds of difficult relationships influence the nervous system, epigenetics, and health. Monde and Hunter have found that insecure attachment ACEs are associated with physical illness in children. These include recurrent ear infections, asthma, cystic fibrosis, epilepsy, failure to thrive, congenital heart disease. A 2019 study by Ali Crandall, PhD, and colleagues in Utah has found that the absence of positive, nurturing, protective experiences may have a greater impact on health and risk for chronic conditions than the presence of abuse and other ACEs. This finding has been a shock to many. It's a game changer for others who have known deep down that something wasn't right, even if it all seemed normal when they were kids. Their difficulties maintaining healthy relationships, liking other humans, or trusting people have just not seemed normal. Their challenges in feeling worthy. Their bodies that don't respond to treatments that seem to work for others. Parents tend to raise their children the way they were raised. This is seen in humans and other mammals, where early maternal care influences epigenetics in the next generation. If one generation grows up feeling unsafe or having little support, this is what they unconsciously role model and reenact with their offspring. Via epigenetics, the effects of parenting are described as a form of social inheritance mediated by epigenetic processes. World Wars I and II and the Great Depression were a deeply stressful and often traumatic experience for an entire generation and whole culture. They are examples of events that have had underappreciated consequences. There is an inspiring set of studies by psychologist Tony Madrid, who found a way to reduce and often cure symptoms of asthma in children by treating their mothers for traumatic events that occurred during the pregnancy, birth, and infancy of their child. You can learn about Dr. Madrid's work at AsthmaBusters. His discoveries have yet to be integrated in other clinics, but they are the wave of the future and offer powerful tools for prevention as well as early treatment of chronic illness.
Klaus and Kennel started doing some research, and it's very clever research. They got experimental groups, which were close contact babies after birth, and a control group, which was the normal way that hospitals dealt with babies and moms at that time. And they studied them at 2 months, at 3 months, at 17 months, and at 3 years. The normal contact moms, they were the moms where the nurse said, "Here's your baby, Mrs. Bacciagalupi, pretty baby. We'll take the baby away and clean it, and we'll bring it back in a little while." The extra contact moms, the experimental group, their babies stayed with the moms. At 2 months, 77% were still lactating. And 80% of the moms were still breastfeeding, as compared to 16% of the normal moms. And the extra contact moms cleaned their babies less, held them more, looked more lovingly at them. And the normal contact moms, "Here's your baby, we'll bring the baby back in a little while." Those babies cried a lot more, were colicky, laughed less, and showed a different reaction than the extra contact babies.
I've been working with asthmatic children for 30 years, using maternal-infant bonding as the platform for helping these children. I'm going to describe maternal-infant bonding. I'm going to show you how it figures into childhood asthma. I'm going to present the paradigm for doing bonding therapy. Maternal-infant bonding is the intense love that exists between a mother and her child. It is biologically engineered. It's emotional, physical, spiritual, behavioral, even psychic. It's all-consuming. It's one of the strongest emotional ties in nature. Two Case Western Reserve pediatricians, Marshall Klaus and John Kennel, first brought maternal-infant bonding to our attention. They explained that it happens naturally and automatically at birth or even during pregnancy. It's a cross-species phenomenon found in animals as well as in humans. But it doesn't always occur. It can be interrupted. For example, when baby lambs are separated from their mothers soon after birth and returned just 4 hours later, 50% of the mothers will reject their babies. If the babies are kept away for 12 hours, the rejection rate climbs to 75%. The same is true for humans. If something interrupts the mother and baby's contact at birth, mothers are likely not to emotionally connect with their babies. A number of studies were conducted by Klaus and Kennel and their colleagues that indicated that non-bonded babies didn't nurse as long, were fussier, had a higher incidence of failure to thrive, abandonment, neglect, and abuse, had more medical problems, and were treated differently, less affectionately by their mothers. When a mother isn't bonded to her baby, she often feels it and knows that something's wrong. She may say, "Something's missing. I don't feel about this baby the way that I feel about my other children." Or she may feel that it's in her child and say, "Something's been wrong with this baby right from the start. He hasn't been affectionate or cuddly." But it's not her fault. Bonding problems occur accidentally. Klaus and Kennel discovered that there are two major non-bonding events that interrupt the bonding process. Physical separation at birth, just like other animals, and emotional separation due to maternal trauma. That is, an event or trauma that distracts or preoccupies the mother so much that she can't bond. When either of these two events occur, physical separation or emotional separation, the chance of bonding is greatly lowered. Now, physical separations occur when the child is removed from the mother or when she can't attend to the baby. For example, when the baby is placed in a NICU or an incubator, when the mother's anesthetized, when the mother's very sick and can't be with her child, when there's a C-section delivery, when the child's adopted, when the mother is sent home and the baby is kept in the hospital, or, Klaus and Kennel say, when the child is a twin or a triplet. When these things happen, there's a good chance that the mother didn't bond with her baby. The second type of non-bonding event, emotional separation, occurs when the mother is going through something in her life that is so intense and overwhelming that bonding just can't happen. For example, when a family member has died, when the mother has had a recent miscarriage, when there are marital problems, when serious drug or alcohol use is in the picture, when the mother's alone, isolated. Any of these events can be so upending that she is distracted and prevented from bonding with her baby. Now, Marshall Klaus is quick to state that mothers often find within themselves the ability to bond even when the stuff happens. But when there is separation at birth or emotional trauma, the chances are that bonding was interrupted. Now, here's the connection between problems with bonding and asthma. Non-bonding events are found in the histories of a surprisingly high number of children with asthma and their mothers. As compared to non-asthmatics, there are 3 times as many children who have bonding problems. The connection between asthma and non-bonding was studied by 3 psychologists. In the first study, Stephen Feinberg found that 84% of children with asthma had histories compatible with non-bonding. And this was compared to 25% of well babies. In the second study, Melissa Schwartz found that 86% of asthmatic children had histories of non-bonding, as compared to 29% of non-asthmatics. And in the third study, Dale Pennington found that asthma was associated with 3 particular types of non-bonding events: separation at birth, marital problems, and maternal grief. Other related studies have demonstrated this connection between non-bonding events and childhood asthma. A Norwegian study of 1.5 million children concluded that, quote, pregnancy complications seem to be a risk factor in the development of asthma, unquote. In the Journal of Pediatric Research, Cursett reports that, quote, C-section deliveries may be associated with an increased prevalence of asthma, unquote. Other researchers have shown that C-section deliveries have a 50% higher risk of developing asthma, and emergency C-sections a 60% risk. Anesi Maisano and her colleagues reported that in utero perinatal factors increase the risk of developing asthma, that is, complications during pregnancy, labor or delivery, child illness, or health complications during the first week. Rosalind Wright at Harvard reported in the American Journal of Respiratory Critical Care Medicine that perinatal stress is a predictor of wheezing in infancy. And Mary Clinert and her team in Denver found that asthma was highly associated with parenting problems that they were able to measure at 3 weeks of age. There seems to be a robust relationship between asthma and bonding disruptions. Now, the startling part of this relationship is this. When you repair that bond in the mother, the asthma gets better in the child. The remainder of this presentation will show you how to repair that bond through bonding therapy. Bonding therapy is a 3-step process. The first step is find out if there's a bonding problem. You need to find out if anything happened to the mother or child around pregnancy and birth. From the information already discussed about non-bonding events, you can get an idea of the things to look for. You can also use the Maternal-Infant Bonding Survey, the MIBS, to help you ferret out the factors that may have led to a bonding disruption. This can be found online at www.asthma-busters.org, or from the website of the clinic where I work, www.rivershrink.com. You need to find out if the baby was physically separated from its mother at birth or soon afterwards, or if the mother was emotionally separated, overwhelmed by some trauma in her life. An eye-opener question that often tips you off to the existence of a bonding problem is this. How did you feel when you first held your baby? Bonded mothers will often say that it was the highlight of their life. They were ecstatic. It's as clear as a bell. They remember it as if it happened yesterday. Those who didn't bond will say something quite different. They'll say that they were afraid, that they were sick, they didn't recognize their child, they didn't feel like anything they thought they would feel, they don't remember it, or that something was less than wonderful. When you have found the non-bonding event, the second step is heal it, therapeutically process it, or metabolize the event or events. Explain to the mother how this is related. Tell her what you're going to do. She often will be relieved to know the way that she's felt about her child was not her fault. And then heal it. Use any method that you can to do so. And it shouldn't take too long. The mother has been trying to heal this ever since it happened. It's been a pebble in her shoe. She may have already done most of the work. The method that we use is just to use straightforward suggestion. You simply tell the mother in hypnosis to heal or repair or mend this thing. The pain from the death of her parent, the pain, confusion, fear, and disappointment over the C-section, being sent home while her baby was in the hospital, being so sick that when her son was born, she didn't even know him, the marital problems that she was having at that time, the miscarriage that she had 6 months before she got pregnant, the embarrassment that she was 15 years old and pregnant. Other interventions such as EMDR, art therapy also work.